Hello there, Mr. Clough Stanley. My name is Jay, and I'll be your student nurse today. We have an order for a head-to-toe assessment for you today. Do you know what that is?
Yeah.
All right. Before we get started, I'm going to go ahead and pull your curtain for privacy and provide hand hygiene. Put my gloves on. All right. Can you go ahead and provide me with your full name and date of birth?
Joseph Lloyd Clough Stanley, May 5th of 97.
Okay. All right. Before we get started here, let me go ahead and your vitals were obtained by the CNA earlier and everything was within normal range. All right, I'm going to go ahead and raise the bed to normal working height or safe working height and lower your bed rails. All right. When going through now, I'm going to go ahead and ask you a couple questions here. Can you provide me with your full name again and date of birth, please?
Joseph Lloyd Clough Stanley, May 5th of 97.
Do you know where you currently are?
Some hospital.
Okay. And do you know what time of the day it is?
Sometime in the afternoon.
And do we know what we're doing today?
Head to toe.
Head to toe. All right. Can you go ahead? I see that you're wearing corrective lenses.
Yep.
Can you go ahead and remove those for me for just a quick minute? All right, I'm going to ask you to look straight directly at me. I'm going to shine this light. Okay. All right. All right. Your pupils are equally round and reactive to light and accommodation. Can you go ahead and pull down on your eyes right here? Conjunctiva is pink and moist. I'm going to go ahead and check your ears. All right, no signs of drainage. All right, go ahead and plug one of your nostrils for me. Okay. Okay, and the ears are patent with no signs of obstruction. Can you tilt your head back for me just a little bit? Septum is non-deviated, and nasal mucosa is also pink and moist, and your lips are also pink as well. No signs of cheilitis. Can you go ahead and open your mouth for me? Say ah. No signs of dysphagia. Teeth are all intact, and oral mucosa is pink and moist and free from any cankers or sores. Gonna go ahead and check your hair distribution and make sure that we check your scalp. All right. Hair distribution is even along the head, and your head is also symmetrical and normocephalid with no signs of lesions or infestations. Can you go ahead and give me a smile? All right, no signs of drooping on the side of the face there. Face is symmetrical on both sides. I'm gonna go ahead and palpate your carotid arteries or your carotid pulse bilaterally. All right, strong on both sides, 3+ and strong on both sides. 3+ full bounding on both sides. I'm gonna go ahead and feel if it is that you have any swollen lymph nodes. All right, no swollen lymph nodes present. I'm gonna go ahead and give you a quick pinch right here. Okay, good skin turgor as well. You can relax a little bit.
I am relaxed. I'm just blind.
All right, you can put your glasses back on.
Okay, good.
All right. All right, so we did all of your head, and we did some neurological checks as well. Everything seems to be normal, right? Alert and oriented times 4 with no abnormal behaviors. Your speech is clear and appropriate, and your pupils are equally round and reactive to light with no drainage from any of your nasal and oral mucosas. All right, gonna go ahead now and I'm gonna listen to your heart sounds real quickly. All right, I'm gonna be listening to 5 different points. So just breathe regularly. Aortic, pulmonic, herbs, tricuspid, and mitral. All right, clear heart sounds with strong S1 and S2 sounds with no murmurs or gallows noted. Everything sounds good with the heart. All right, next I'm going to go ahead and also take your lung feels. I'm going to go first anteriorly, then lateral on both sides, and then posterior, okay? All right, all I'm going to do is ask you to take a deep breath every time you feel my stethoscope touch, okay?
All right.
All right. Your shirt here for a second. side. Your arm up for me. Alright. And on the right side, lift your arm up for me. Can you scoot forward in the chair for me just a little bit? Alright, and go ahead and do your posterior. Alright, lungs are clear to auscultation anteriorly, laterally, and posteriorly, right, with no adventitious lung sounds noted. Respiratory rate was unlabored with normal respiratory rate, and lung sounds were clear, and your chest was symmetrical in the rise and fall with inspiration and excursion. Alright, next I'm going to go ahead and check your arms here real quick in your skin. Skin is warm, dry, and intact. No breaking of the skin is noted. No IV sites. I'm going to go ahead and palpate your pulses bilateral brachial. Alright, hair growth is even on both sides and bilateral of the arms. Let me go ahead and palpate your radial pulses here. Both brachial and radial pulses were 3+, full and bounding bilaterally. Go ahead and squeeze my arms. Alright, strong hand grips and bilaterally. Going ahead with the capillary refill. Bilaterally, that was less than 2 seconds, which is good. And there's no clubbing of the fingernails. Alright, and also no signs of edema in the arms. Next, I'm going to go ahead and have you lay back a little bit. I'm going to go ahead and do an abdominal check here for you, okay? So let me go ahead on this side. No, lean back. Can you lay back?
You just locked it.
I did?
Yeah.
Okay.
There it goes.
Okay, there we go. Alright. Now you want to lay back as flat as you can for me. Thank you. Alright. Next I'm going to go ahead and listen to your abdominal sounds. Alright. It's going to be a little bit cold. We're going to start with the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Alright, your abdomen is soft, non-distended. I'm still gonna have to soft, non-distended, and flat. And next I'm going to go ahead and palpate for any masses or tenderness, alright? Let me know if it is you're feeling any pain in any of the sides that I'm going to be palpating, alright? So we're going to start with the right lower.
No.
Right upper.
No.
Left upper.
No.
Left lower.
No.
And palpate a little bit deeper. Right lower.
No.
Right upper.
No.
Left upper.
No.
Left lower.
No.
Alright. All's good right there. Active bowel sounds were auscultated in all 4 of your quadrants with no pain or tenderness noted. Your abdomen is soft and non-distended and flat, and there were no tenderness or masses on palpation. Next, I'm going to go ahead and check your feet here. All right, there's no visible signs of edema. Hair growth and distribution is even on both sides, which is an indication of good circulation. Let me go ahead and palpate your posterior tibial pulses bilaterally. Alright, strong bilaterally, and go ahead and relax your feet a little bit. Okay. Your pedal pulses. Strong bilaterally as well. Can you go ahead and pull your feet up towards your head for me? Alright, and push away. Okay. And lower extremity capillary refill is less than 3 seconds, which is good. Alright, so once again, no edema on your lower extremities. Capillary refill is less than 3 seconds with your pulses bilaterally on both sides, indicating good circulation or strong. Alright, up next I'm going to go ahead and ask you a couple questions here. As it relates to your urine, are you able to hold it until you get to the bathroom?
Yes.
Does it burn? Do you have any difficulty urinating?
No.
Is there any color or is it odor?
No.
Okay. All right, and I don't see that you have a Foley catheter, which is good. Have you ever had a tracheostomy before?
No.
All right, trachea appears to be midline. All right, oh good. And as it relates to your bowel movements, when was the last time you had a bowel movement?
Yesterday.
All right, is that usual for you?
More or less.
All right, do you have a regular routine? And are you able to hold it until you get to the bathroom?
Yes.
Okay, and I don't see that you have an ostomy present either, so that's all good as well. Just making sure that I go over my checklist here, just to make sure everything's all good and taken care of. So we went over your head. We realized that your head was normocephalic, unsymmetrical, with no facial abnormalities. Your nares were patent, and your eyes and ears had no signs of drainage, and everything looks good. Your hand grips were equal bilaterally and strong. You have regular bowel movements, and you were able to hold a continent of bowels, and you were also continent with urine. We checked your abdomen. Everything was good there with active bowel sounds in all 4 quadrants. We checked your heart sounds. There was nothing that required anything out of the ordinary with your regular heart rate and rhythm with no murmurs, and it was your S1s and S2s were audible. S1s and S2s are basically the lub dub, so it's how your heart sounds. All right, and we checked your skin. You have no IVs currently. Do you have any rashes or wounds or anything that I should be aware of? No. Do you use a walker or any assistive device in ambulation?
No.
Okay. Let me go ahead and have you sit up real quick. I just need to do one more check, and then we're all good to go here. All right, looking at your spine right here. Your spine is in alignment with no curvature. All right, and your posture is upright. Can you go ahead and move all your extremities for me, and you're able to move them independently? All right. Well, that completes our head-to-toe check for today. I'm going to go ahead and lower your bed. All right, we're going to go ahead and set you back up in a comfortable position. Oh, I hope I didn't hurt you with that. Okay.
Scare the shit out of me.
Well, hold on. Don't worry, that was not very appropriate, but we'll let it slide this time. All right. We put your bed rails and your chair rails up, and document all of the proceedings, all of your findings. I'm gonna go ahead and wash my hands. Go ahead and open your curtain up, and if you have any questions or queries for me, you can let me know.
Okay.
Okay.
Enough for your notes.
Thank you. All right. You have a good day now, Mr. Clough Stanley.